In every big city in this country, it seems, there is a serious shortage of nurses. It's a very tough job, and nurses who have qualified only after demanding training are just as much in demand in places where the living is better. So what is a big city hospital to do? We put this on the agenda because of what they did in Philadelphia. Our agenda reporter is Beth Nissen.
West Philadelphia is gritty and poor, not the kind of place most people want to come to work. That was a problem for the Presbyterian Medical Center here, which suffered a condition chronic in inner-city hospitals, a shortage of nurses.
We were trying to be very competitive, offering high wages, and we simply couldn't get registered nurses that we needed.
Then one day, the hospital director looked out his window.
I saw people walking up and down the street, healthy people, and I said, why aren't they working in nursing?
The people he saw were the working poor of the neighborhood, like Kevin Lofton, a medical supplies clerk at the hospital who had been out of school for 13 years.
Was not the typical very promising nursing candidate. When I applied to come to school here at Presbyterian, I was 30 years old.
Kathy Adorno was 36, a secretary highly experienced in a job with low prospects.
I was shuffling papers around. I was making sure that we got the bills paid. But there was no personal contact. There was no contact with human beings.
Never administer a drug that is not labeled. Send it back.
What Presbyterian did was open a school of practical nursing with an emphasis on the practical. In 1 year, students could become licensed practical nurses. Average annual salary, $25,000.
When you look at the drug, make sure it is not discolored.
The school actively recruited neighborhood residents who had a high school education and a strong desire to care for others. More than half were older than 35. 1/3 were or had been on welfare. Almost all needed extra help.
The orange is your way of being able to simulate the thickness of going through someone's skin with a needle.
Kevin got tutoring in math and science to help him pass the school's entrance exam. Once he was admitted, the school gave him a generous scholarship and a flexible schedule so he could still work part-time.
Kevin, you see how her hands are swollen?
School officials say a student like Kevin is worth the extra effort. They know it whenever they see him with patients.
My most valuable attribute, my most valuable quality is the fact that I care.
Kathy, too, was a natural at caring. She was a single mother raising 3 girls. The school invested heavily in her, giving her tuition money, helping pay for babysitters, and arranging a 2-year night program so Kathy could keep her full-time job. Even with all the help, it was hard going.
It would have been easier to just say, I've bagged this, I can't go through with it, I just can't make it, I have all these kids, I have all this homework, I just can't do this. But I just wanted it bad enough to do it.
2 months ago, Kathy, along with everyone else in her class, passed state exams and became a licensed practical nurse.
You had the fortitude, guts, to show that you can achieve.
It was the greatest feeling I've ever felt in my whole life. It was like just such an accomplishment. And I was actually, for the first time, proud of myself.
Kathy has now joined 46 other school graduates on Presbyterian's nursing staff. The program is a success. The medical center has the nurses it needs. The graduates have skills in demand nationwide. Presbyterian helps its new practical nurses go even further. Gina Robinson, who became an LPN last year, is now studying to be a registered nurse. When she graduates next year, her annual salary will jump to $40,000.
I just want to go on. I just want to go on and reach higher goals.
I'm looking for the first graduate to become a physician. It'll happen, it's just a matter of time.
Deep breath.
What this one inner-city medical center is doing is what hospitals are supposed to do. It is making people better. Beth Nissen, ABC News, Philadelphia.
The warning signs are clear. Enrollment in advanced nursing programs is falling steadily. Nursing bachelor degree enrollment last year was off almost 5%, and shortages are growing. Hospital budget cuts are blamed, as is the lure of competing careers. So, as Thalia Ashuris reports for tonight's Eye on America, nursing care in some hospitals is becoming do-it-yourself.
Can you eat?
New Jersey mom Sharon Kroll has her hands full with her 2 boys and an extra challenge with 6-year-old Michael. He's developmentally delayed and has a number of physical problems.
I never let him out of my sight. You constantly have to be with him.
Michael's frequent life-threatening seizures have landed him in the hospital more than 10 times. It's in a hospital that Kroll did not expect to be on guard, as she is at home, taking on duties which are normally the responsibility of a nurse.
To make sure he's stabilized, doesn't have any more seizures, doesn't try to pull out IVs, doesn't try to fall out of the bed and hurt himself.
There's not a nurse available?
No, unfortunately, they're busy with other people.
It's an all-too-common complaint. In New Jersey, this year alone, 7 hospitals have been cited for not having enough nurses on their floors. In fact, a recent study indicates the nursing shortage is spreading nationwide. 94% of hospitals in the West have declared or expect a shortage, 82% in the Northeast, 75% in the Midwest. The biggest concern is for the future. Projections are that in 20 years, the country will have 20% fewer nurses than it needs. That means hospitals like this one in Connecticut are going all out now to attract recruits.
We're trying every creative mode that we can come up with.
The competition for qualified nurses is fierce. That's why Waterbury Hospital launched an aggressive ad campaign with billboards and radio spots.
Waterbury Hospital has some incredible employment opportunities.
The hospital even offers bonuses of several $1,000s to recent nursing school graduates, like Wendy Richardson.
A lot of places are offering bonuses. There's also increase in pay rates for per diem jobs and that kind of thing. All you have to do is look in the classifieds to see what the situation is like.
For Sharon Kroll, a prescription for the nursing shortage couldn't come soon enough.
If I was not there, he would definitely not get the care he needs at all. I worry about it a lot.
And it's a worry many Americans will be confronted with if the number of nurses continues to decline.
How did you do this?
In Annandale, New Jersey, I'm Thalia Ashuris for Eye on America.
Tonight we take a closer look at the nursing shortage in this country. It is a crisis that carries opportunity. Nationwide, there are 110,000 nursing positions available now. The Labor Department predicts that figure will jump to 800,000 openings by the year 2020. Now, this means salaries will keep going up, but will it solve the shortage? Here's ABC's Brian Rooney.
Jennifer Hall of Grand Rapids, Michigan, works with newborns and mothers at a hospital outside Los Angeles. She's what's called a traveler, working on a short-term contract, and it's quite a deal.
I get free private housing, I get utility reimbursement, I get free insurance.
She makes $60,000 a year, working 3 days a week. It's an indication of how desperately hospitals need nurses.
We need help, and we can't do it alone. And I think the community needs to recognize that responsibility.
Big deep breaths for us.
Nowhere is the problem greater than in California, where a new law requires 1 nurse for every 5 hospital patients.
For those who don't know anything about it, nursing can have an image problem. The assumption that it's a life of emptying bedpans.
Compassionate. One nurse replacement firm created an online reality program to show what fun nurses have in their off hours.
Hey, Paul, this is Allie over at Access Nurses.
They also have a call room, like a political campaign, recruiting traveling nurses from all over the country.
We're also looking in South Carolina or Missouri.
Salaries are steadily rising, but the real attraction of nursing might be guaranteed employment.
For nursing, there's no solution in outsourcing these jobs. The solution is to increase the number of nurses in the United States.
From the research that I did, it's definitely something that over the next 10 years, it's one of the biggest growth industries.
Patrick Currid left the aerospace industry after 10 years and went back to school to become a nurse, like his wife.
You're guaranteed a job. You come out of here.
Absolutely. Yeah, in fact, I already have one.
Not so fast, though. Nursing school takes 2 years, and there aren't enough schools. Some have a 3-year waiting list. Brian Rooney, ABC News, Los Angeles.